Hi, this is Dr. Tom Rogers coming to you with a weekly podcast of what I call the Common Sense MD. Today I have two special guests, if you notice them, Andy and Margaux, two extraordinary PAs that have been working with me for a long time. And we're going to talk about something not so common that's probably unknown to most of you. We're going to talk about parasites and parasite cleanses. I've heard for years about this company called CellCore, and it turns out that it's really interesting and could be life-altering for a lot of people, especially those that have stomach problems, autoimmune diseases, chronic inflammation. It's so prevalent. So, believe it or not, these two were kind of guinea pigs for the CellCore cleanse.
We like to try stuff before we send it out to the masses, and this seemed like fun. And actually with CellCore, the reason that I kind of got interested in it was a practitioner friend of mine out in Colorado said that this was life-changing for her. She had gone gluten-free in college. She was a collegiate athlete and was falling asleep on the courts. And it was so bad. Her fatigue was so bad and her joint pain was so bad. She had negative testing for everything. She didn't know what was going on. And then she went gluten-free, which changed her life, but something was missing. She says nearly every patient they see in functional medicine out there goes on the CellCore program, which is how I got interested in it and wanted to bring it to our team. And Margaux is our autoimmune specialist. Autoimmunity is very near and dear to her heart. We're going to do a couple more podcasts on what autoimmunity can look like. But parasite cleanses, we all got worms. You got them. I got them. Margaux definitely has them.
I sure did.
You definitely got worms. Okay. I had salmon this morning. I had bagels and lox. Like I'm reintroducing all these worms that I've killed out from CellCore. So we're really excited to kind of bring it out to those that might be interested in a parasite cleanse, but it's not just parasite cleanse, right? It does a lot of other things. It kind of cleans out the system. So if you kind of want to explain what CellCore looks like.
Sure. So we have a CellCore Foundational Protocol, and that helps cleanse any sort of gut pathogen or parasite. So it doesn't have to just be parasites. It can be bacteria, viruses, things like that. It also helps cleanse any sort of environmental toxin. So we live in a very toxic world, and we can pick up a lot of things in our lifetime. So there are heavy metal toxicity.
Yes.
There
Mold,
are
phthalates, parabens.
A lot of things in our water. So it's really helpful to at least cleanse that, once every few years. I would say.
Trying to get Ben off of the tap water in the Fountain City Clinic. I've been working out of the Fountain City Clinic a lot with Margaux, and Ben drinks tap water. So we're really trying to help him out with that.
Trying to phase him out, yeah.
We're in a very toxic world. I tell patients that all the time. I mean, do you tell patients that all the time? We live in a toxic world. It's tough to avoid.
Every day. So, and it all starts with gut health. So, but there's a lot of other toxins, like you say, heavy metals, parabens, and what's in your water, fluoride.
And we absorb it. You put it on your scalp. You use it in detergents. I mean, it's everywhere. So this is a great way to say, how do we deal with the modern world? Because we can't, I don't want to say we can't, but it's going to take a long time for us to really clear all those toxins out of the products that we use every day. So this is a great way to cleanse, detox. If you're a patient that's experiencing any autoimmune issues, just like we were saying at the beginning, joint pain, fatigue, gut issues, the unexplained, a lot of patients just say, I know something's off. A parasite cleanse is a great way to go. So what Margaux and I did, we're going to talk about our experience, because I've texted Dad a lot during this. I was like, I cannot believe what's happening. We did the 4-month foundational protocol. And the 3 that we're going to offer as a clinic right at the beginning as we get used to this company is a foundational protocol, which is it's a 4-month protocol that has energy and drainage, has gut and immune support, and then there's the actual detox, because we really have to get our systems working before we shed. There's a comprehensive panel, which is a 9-month protocol. It's a lot, but that's for very, very extreme Lyme disease. They recommend Lyme disease patients going for the comprehensive. That's a whole process that's going to clean out everything. And then individual parasite cleanses. And I've learned even from this company, a lot of other countries routinely do parasite cleanses. So Margaux and I did the foundational, and we passed worms. We did, both of us.
I was shocked.
so I experience it with mine. I have to, and two, if it's like both of us have experienced autoimmunity, so they're through TPO, Hashimoto's, through type 1 diabetes. So whenever you have an autoimmune marker, you're more than likely to get other autoimmune disease. It opens us up to that. So we're kind of already have gut dysfunction from that. And so I passed the worm in month 2, and I'll never forget it. I was like, it was an odd time. This is going to I won't get too TMI, but whew, it was just like, was an odd time to have a bowel movement. I was like, okay, I'll just go. I was at a coffee shop and it wasn't actually a bowel movement. And I never really looked, and I looked, and there was an actual worm. And then the next day I passed eggs that was within the stool. I know that sounds crazy. I did take pictures of it. You're going to have to take my word for it. A lot of people who go on CellCore take pictures. I didn't. So that has happened to me now on 2 occasions, and I'm in the middle of month 3. When did it? You don't have to get graphic, but you have passed worms.
I have.
That you've visualized.
I have passed multiple worms. They were a bit long, and
it's insane.
Yes.
It's insane. It feels like it's something from like Alien. but too, and you've explained to me that you feel better.
I felt so much better. And now, in month 3, I started feeling more alert in the mornings. I didn't have any residual fatigue. I felt like I needed less caffeine. I just felt so focused. I felt so good. And I've rechecked my TPO. It's already started to go down.
Which is very hard to do.
Yes.
It's very
so TPO
hard.
is an autoimmune antibody, and it is notoriously difficult to start to monitor it decreasing, and it is starting to decrease. So.
Yeah. So too, I mean, I love that the proof is in the pudding, but we've tried it. So we know that there is some benefit that comes from it. The reason the foundational protocol is so long with a 4-month is that their big thing is that you have to get your systems right. It would almost be like if you went out and went to CrossFit day 1 instead of training to get there, or ran a marathon right at the beginning. You want to get your body moving and working. So the first part is about how you get energy and drainage. And they have this whole program, but this protocol on how to get your systems moving so your liver is ready for the detox. Because have you experienced patients who have had Herx reactions?
Yeah, that's the reason in talking to you guys about this program, I like it because a lot of detox programs are really harsh. And when you're shedding, detoxing, whatever, it's miserable, and most people wouldn't want to do it. So this 4-month program to me is ideal because you weren't miserable with this, were you? I mean, it was
Not
doable.
in the least bit.
Nope.
Okay.
And I can attest to how much easier this detox was than in the past. I did a GI map last year, which we can talk more about in a bit. And I did have a bacterial pathogen. And when I was getting rid of that, I had the Herx reaction. I had flu-like symptoms for several days. It was rough. And I never had any of that when I was passing the worms.
And so, too, it prepares your body to be able to pass these. When I talked to the company and the leaders, I found this at A4M, testing. So if you're interested in this, do you have to test positive for worms? No. And I asked them that. I was like, do you have to name a worm, the helminth or whatever, before you go into this? They said no. And I was like, well, how do you know you're doing it? They said, if you're they're like, do you have a dog? I said, yes. It's like, do you deworm your dog? I said, yes. I was like, does the dog sleep in your bed? I went, yes. You have worms. I also eat I eat raw sushi. We're full. I mean, it's hard to avoid. And so there's not a particular test that you have to do in order to qualify to say, I need to pass this. We can assume that all of us have worms. Maybe if you're on enough ivermectin preventatively. Do you still have patients that do the ivermectin twice weekly?
Yeah.
So maybe a little bit less worm with that, but you can assume that you already have it. So there's the comprehensive 9 months, foundational 4 months, which is for most people. And then there's also just specific parasite cleanses. I have a patient that her chief complaint with coming into me, I'm wondering if you've ever heard of this or you have, she feels really like, she says, this is her words, that she feels insane with the full moon and has a massive headache every full moon. We went with hormones, changing progesterone, Nurtec just to help with symptoms. With the full moon, that's when the eggs are hatching. So they say that actually do the parasite cleanse around that time. So she's a patient that I'm going to try this out on a just a specific parasite cleanse, because the cycle, if you look at the cycle of the particular parasites, that's how they grow. And remember, they're parasites. They're living off of you. That's not a symbiotic relationship.
There's a lot of people that think that parasites cause cancers.
Exactly.
And,
which is why fenbendazole, a dewormer.
Yeah, exactly right.
helps.
Which we use. We have incredible success stories with fenbendazole. Had one call me this week, just incredible. And you had one last week.
I did.
But let me ask you something real important. So you go through this process and you get cleansed. What do you do to change from getting it again?
Well, since you've gone down into the river to have your cleansing moment, you've been washed away of those. I'm just kidding. I'm sorry. The cleansing does sound a little bit like a baptism. Now, this is what they told me, and see if they said anything different, because Margaux's been through all the training. Margaux's going to be our CellCore lead. She's going to be our GI map and our gut lead and our autoimmune lead. We have 3 specific tests and protocols that are going to be specific to Margaux, and she's gonna clean you up. She's gonna be the cleanse, which
We're going to get rid of everything.
We're gonna get rid of everything in the gut, but not the good stuff. We're gonna keep the good stuff. So too, yes, with the particular foundational, they said that you can repeat the particular parasite cleanse 1 or 2 times a year.
Okay.
So too, they say that it's upkeep. They love the BC ATP. They call
Yes.
it brain candy. That's a particular energy and drainage molecule, or I guess one of their naturals. All this is too natural. Everything this is not a prescription. You do have to have a patient code in order to order it. So how you get started on this is, if you're interested in the CellCore, you'll book with Margaux. She'll direct you to say, how do we order this particular packet, and what can you expect with your program? There are ways to tailor it for patients that might be sensitive or might have a potential herc, so you can take it a little bit slower. And they do recommend bowel mover. I never had to do bowel mover.
I did not have to use bowel mover.
They say it can constipate you if you're not worried. They want to make sure that you're having normal bowel movements every day. So they have a particular intestinal formula that is called bowel mover that I've had patients try individually and love.
Right.
So that's kind of how that process starts. You can repeat the parasite cleanse. You can every so often, or every couple years, do the foundational. Is that right?
Right. I would recommend doing it every year.
Yeah, 4 months out of the year.
Yeah.
Why not? Clean it up.
And would you recommend anything like quit eating raw sushi or changing habits, maybe?
Oh,
What would you
for
recommend?
sure. If you can avoid stuff like that too, even I've looked a lot lately, and a lot of people at the office, Carter, Katie, Robin, they all clean their food very intensely. So there's a lot of big moves online to actually. There's a big salmon thing, which I love raw salmon. That if you actually watch it under a microscope, it's full of worms. But you can put things in, like you can soak fruits, especially,
Yes.
in baking soda.
Yes.
Is that right?
Yes, you can.
Okay.
Interesting.
And then I would also work on eliminating any other sort of toxin. So if you can grow your own food or shop organic, make sure that you have a water purifier and that you're drinking purified water. If you don't have a systemic water purifier, having a purified water shower hookup.
Yeah, you have that.
I do. Well, I have
your
the
whole
purifier that is on the water intake, so everything in the house is purified because it's getting
Margaux's
into
got
your
it going
laundry,
on.
your dishes.
It's true. And you notice, I remember you said you noticed it with your skin.
Yeah, my skin cleared up. I was getting some dry skin and some rashes, and my skin cleared up when we put in the water purification system.
It's amazing.
This is amazing. So, to wrap it up, what kind of patients that are watching should contact us to do this cleanse?
If you have had any sort of gut issues, if you know that you've been exposed to these sort of toxins in the environment, if you have chronic fatigue, inflammation, joint pain, what else?
Or if you're interested, I have a lot of people that say, do you do detox? And I'm like, sure, but what do you mean? And so a lot of it is you're using yucca root or fulvic acid, and you try to bind these things to get them out, but we didn't have something that was specific to detox. If you've ever said, I just want to detox and I just want to get rid, this is for you. The way to do it is going to all gut health and all autoimmunity is going to be with Margaux, which we're so excited about. So you can do a GI map and test for the microbiome to replenish and to clear out some bacteria, viruses, and rebuild. You can do a parasite cleanse. You can do a comprehensive cleanse and get rid of metals, phthalates, mold, toxins, you name it. And two, our next podcast, and in fact, we're going to talk about specific testing called advised testing. That's going to be really specific for autoimmunity and for especially for those struggling getting into rheumatology. So
Yes.
we're really getting some specificity with autoimmunity, which is exciting.
Very exciting.
Who wants worms? Okay. Wait, isn't there a book called I Got Worms? Or
That's Dumb and Dumber. That was in the movie.
I Got Worms.
I'm really pumped about this because, and you just gave me a great idea. So when you cleanse, then you can use binders like fulvic acid, maybe activated charcoal, and avoiding certain foods that you shouldn't be eating. So that's just really good coming from a type 1 diabetic, somebody with Hashimoto's, our expert on autoimmune diseases. That's one thing I've noticed with integrative medicine. You know, one person can't know in depth everything. That's why performance medicine, I try to have everybody have a little area of expertise. And
Exactly.
That's worked out just great for us over the last 18 years. So think about CellCore and think about Detox
Absolutely.
and
gut health.
and gut health, which we talk about all the time, but this takes it to another level. So Andy, Margaux, thank you for sharing this with us. And
Thanks. Yes.
we look
Thanks
forward
for
to doing
having me.
another one on the autoimmune type things.
And two, telemed. This can be through telemed too, so you don't have to be in the Knoxville area to be able to do this. So two, this can ship. They drop ship to you from CellCore.
Okay.
So
Okay.
yeah, we're excited.
All right. Great. This is Dr. Rogers, the Common Sense MD. We'll see you next week. Thank you, guys.